Covering St. George for you tonight, where a cancer patient says he's facing challenges navigating the healthcare system.
His story's drawn attention to how patients with limited resources can struggle. It's an exclusive interview. Liv Kelleher hears from his story from the friend who's been by his side every step of the way.
A close friend of Lewis Banks says he was diagnosed with lung cancer a little over a year ago, and it has metastasized to his brain. That friend, who has now become an advocate for Lewis, says his determination hasn't wavered.
And so he wants to fight, and I guess I'm in his little army.
Wesley Mathis has stepped in to support his friend Lewis, who is living off of Social Security in low-income housing. Lewis recently was admitted to the hospital. Mathis says the fear of returning home without additional care has caused him a lot of stress.
That's what he's been having recently, is a lot of anxiety attacks. And when he has those attacks, what spurs on the attacks, I think, is his inability to breathe.
Despite protesting and appealing, Lewis was discharged yesterday afternoon.
I spoke with the nurse, and she said, "You better come and get him, because at 12:01 it's going to be too late."
Wow.
And so I went down and picked him up, and he was just waiting out there in the wheelchair.
If you weren't able to pick him up yesterday, or if there's anyone else in this circumstance who doesn't have family or friends here, what could have happened?
They told me they would do this. If I wasn't there by 12:01, they would get him a cab, pay the cab driver to take him to his room and drop him off.
I reached out to the St. George Regional Hospital to get their response. A spokesperson for the hospital told me privacy laws kept them from talking about specifics in Lewis's case. They did say Mathis's viewpoint may not account for the whole story. They did provide an extensive statement, and part of it outlining options given to patients before they're discharged. That includes outpatient palliative care, home hospice care, or follow-up appointments with the clinic to treat their diagnosis. They also said other teams will work with the patient on possible financial barriers. Their full statement is with this story at KUTV.com. What's next for Lewis? His friend says it's keeping medical care, getting stronger, and starting chemo. In St. George, Liv Kelleher, KUTV 2 News.